Jesse Hidalgo here with Hearing Group. Today joining us is Dr. Hileman. This is Brandi. She's from our Derby location. Welcome. We're glad to have you.
Thanks. Glad to be here.
Good, good, good. Today we're going to be talking about the appointment process. So sometimes patients, they get kind of nervous about calling in for a hearing test. Have you ever noticed that?
They do.
Yeah.
They're hesitant.
Yeah, and why do you think that is?
I think part of it is denial. You know, they don't really want to admit that there might be a problem. And they're calling in maybe because they're being persuaded by family members to call in.
That could be. I know for me, when I had to wear glasses, my goodness, I really didn't want to wear glasses. And so I really didn't want to go see the optometrist in order to find out the results of whether I needed glasses or not. Oh my goodness, I was so happy I did once I did it.
Right.
So do we find that with our patients?
We do. You know, once they call in, get the appointment scheduled, and we give them results, I think they're relieved that they know there really is something wrong, and maybe not everybody around them is crazy, that, you know, that they're not hearing things properly, that there is something wrong with that hearing system.
Yeah, in fact, some of the patients I've heard oftentimes after we get done with the process, they comment, wow, this was such a nice process that you guys have here.
And easygoing and relaxing.
It is. Mm-hmm. So really our patients really don't have anything to interfere. It's really pretty set back and relaxed.
Mm-hmm. Very laid back.
Yeah.
And very informative. You know, we walk them through the process so they know what's happening along the way.
So let's kind of break it down just a little bit in regards to when should they call?
A patient should call in, you know, when they feel like they're having difficulty hearing, you know, in certain situations, or when they feel like they're withdrawing from their daily activities, not going out to dinner, not going out to social events, and just kind of staying in their primary community circle of friends and family.
Well, I've even seen it where patients go through and they've told us that family comes over and then they go take a nap, or they'll go watch TV in the other room.
Right.
And so they're just not associating. If they are noticing that they're turning up the TV too loud.
Yes, TVs, radios, those are always signs of potential hearing loss.
Yeah. So some of the other things that we see, and we see that hearing instruments are for everybody, and even people in the workforce. And so sometimes we get the working class that still comes in and they're missing parts, maybe at work. Mm-hmm. So tell us a little bit about that.
You know, in the working field, you know, you may be going to meetings, like in the conference room with groups of people, and you're missing conversations at the ends of the table, you know, kind of trying to fill in the gaps. You know, there's lots of transitions from meetings to sitting at your desk on the phone with clients or other coworkers. So when you start noticing difficulty carrying on those conversations, that's a good time to come in and see us.
So we've identified some of the signs when a person should come in. So now all they need to do is just pick up the telephone.
That's
that
right.
Dreaded call, right?
The dreaded call, but I think we always make it pretty easy. You know, we're very personable, we're very friendly. We'll get your contact information, find a time that works best for your schedule and our schedule, and get you in and start the process.
They may ask them some information right up front, which is pretty important in order for us to create a file for them, right? So what are some of the different questions we may ask them?
Obviously, we're going to get contact information, name, phone number, email. We might ask you a little bit about your hearing ability. You know, do you feel like you're having trouble? What areas do you feel like you're having difficulties in? Have you ever had your hearing tested before? Have you ever worn a hearing aid before? And we're also going to ask you if there's someone you can bring along with you to the appointment. One, to kind of, you know, help you feel a little bit more relaxed and to fill in some gaps, and to have a familiar person with you at that appointment.
Yeah, and that matters, because what patients maybe don't understand or don't see behind the scenes is prior to them coming in, we're actually looking at that file. Mm-hmm. And we're trying to digest exactly what may be going on now. Even though it's just limited information, at least it kind of gives us an idea of what's happening with them that way.
Correct.
Yeah. So, okay, so they book the appointment, we find a convenient time for them, they actually make it in. So tell us a little bit about that experience. In your practice, it's a pretty open concept where everything's pretty much just open, and so it's pretty transparent that way. So tell us a little bit about that process.
So you're going to come in, you know, we're going to greet you, verify information, make copies of insurance cards if applicable, and then we're going to start the process. The first thing, you know, I'm going to sit down and just ask you some questions about your medical history, you know, if you've ever had any ear surgeries, strokes, traumas to the head, any history of noise exposure, you know, if you worked around noise, military, farming, those kind of situations. And then we're gonna take a peek in your ears. We're gonna use that video otoscope and look in those ears for wax, ear fluid, any deformities of the ears, and just, you know, take a peek and make sure that ear is healthy before we start the testing.
Yeah, and I think all of that's a pretty easy process. There's one important question that we always try to find out, and I know you do this every single time, as well as all the other professionals, no matter where you're at. If you're out there, they should be asking you this important question: how has your hearing loss progressed? Is it all of a sudden? Is it a sudden onset?
Right.
Or has it just been gradually coming on? Why is that question important?
And that question's important because if it's a sudden onset type of a loss, we may want to refer you to back to your medical doctor or an ear, nose, and throat physician to get some medical clearance to make sure there's not something else going on besides just a hearing loss.
Right, and so there's more than just one telltale sign,
Right.
as far as when we would refer to the doctor, but that's a pretty important clue, right?
Very important.
Yeah, and so now we got done with that. We looked inside their ear, we asked them all the case history, we determined from the onset or the beginning, is there a reason that we need to send you to the physician, or can we proceed on with the test? So we do the test, and then we go through the results. Are we looking again for any type of referral scenario?
Yeah, when the test results are, you know, when we've completed the test and we're looking at those results, we are looking to make sure there's nothing that, you know, might require a referral back to a doctor. If there's a discrepancy in some of our test results, that will be kind of a red flag for us to say, hey, let's have this checked by a medical professional, and then we can proceed with hearing aids if they give us the okay to do so.
Yeah, and that's so important because the patient only knows so much. They can only tell us so much, but the test results are pretty definite.
Yeah, they tell a lot.
Yeah, between what they're telling us and what we can determine from the results, we can help them make an intelligent decision.
Correct.
Right? And it's really, at least with Hearing Group, and we're sure with all the other professionals out there, it's all about the patient's best interest. It's all about their health.
Right, yeah, we want to do what's best for them at all times.
Exactly. So really, an appointment, it could be just as easy as that. After that, we go through and we find a solution for them, obviously.
Right.
If they have hearing loss. If not, we pat them on the back and say, congratulations.
See you next year.
Yeah, see you next year. And that brings out a good point. How often should a person get a hearing evaluation?
They should get a hearing evaluation once a year. I also tell my patients, if any time in between that year, if you feel like something's changed significantly, or you're just noticing more issues, call us and come back in and we'll test you sooner. But once a year is kind of our rule of thumb.
Yeah, it's just like getting your health check every year at the doctor, right? Well, Brandi, thank you so much for joining us. This has been great information for us to know. Again, Jesse Hidalgo with Hearing Group. Thank you for joining us.